Alright team, let's get started. We have a patient with symptoms of appendicitis, parotitis, and cealadenitis. What do you think we're dealing with here?
I believe the diagnosis is likely Waardenburg anophthalmia syndrome given those symptoms.
I'm not so sure about that, Leslie. I think it might be something else entirely. Let's consider other possibilities, too.
Yeah, I agree with Randall. We should explore all options before jumping to conclusions. What do you guys think?
You guys can argue all day long, but trust me, the diagnosis is Waardenburg anophthalmia syndrome, and we have our work cut out for us because it's going to be risky. All of you need to get ready for a prostatectomy.
What now? What now?
A prostatectomy, Randall. Get your things together because that's the treatment I see fit for this case.
Wait, Hawks, are you sure? That seems extreme.
Yeah, Hannah, I have to agree with you. This doesn't sound like a normal course of action.
Look, I've been doing this for years and I know what I'm doing. The patient is sick and needs a prostatectomy.
I understand your expertise in the field of medicine, but you have made mistakes before, Hawks. We can't just ignore them.
It's a simple case of Waardenburg anophthalmia syndrome with a simple solution of removing the prostate.
A simple case. Are you stupid, Hawks?
I would be if I wasn't suggesting a prostatectomy.
How is he doing? The patient was supposed to be fine after the prostatectomy.
I'm afraid Dr. Hawks might have made a mistake. We should double-check his notes.
You think it's possible?
It wouldn't be the first time. I've seen him make errors before, although he never admits them.
What do you suggest we do then? The patient is in critical condition now.
Putting the prostate back wouldn't be a bad idea.
What's your prognosis for this patient? It's a mess you've made. You nearly killed him with that misdiagnosis and unnecessary surgery. I expected more from you all.
We were sure it was Waardenburg anophthalmia syndrome, Dr. Hawks. We based our diagnosis on the patient's symptoms.
And his family history. Plus, the genetic tests we ran came back positive for the syndrome.
I still think you're overreacting, Dr. Hawks. You were wrong, too, in your initial assessment of the patient's condition.
That's enough. I'm not here to rehash old mistakes or play the blame game. What do you think the actual diagnosis is now?
Playing the blame game is what you're good at, though. Maybe if you blame yourself, the problem will resolve itself.
I'm gonna blame it on my lack of lunch, which eagerly awaits. Piss off. So, how are things in the oncology department?
Oh, they're doing quite well, actually. We've been seeing some great results lately.
Cool. In my case, it's been more of a mystery to solve than an opportunity to capitalize on. I'm dealing with this patient who's been showing all the symptoms of this rare disease. But none of the standard treatments are working.
I see. That sounds like quite the conundrum you've got there.
Exactly, but it just hit me. That's why these treatments aren't working. I finally figured out what this is.
Oh, well, don't keep us in suspense here. What is it?
I stormed into the operating room because I had to set things right.
You can't just walk in here like that wearing your casual clothes.
We have strict protocols for entering an operating room, Hawks. You should follow them.
Your disregard for safety is concerning, especially when you're the one making life-altering decisions.
I know the rules, but I couldn't let my mistakes with Waardenburg and ophthalmia syndrome go uncorrected. Now we have a new diagnosis. Benign symmetric lipomatosis.
Benign symmetric lipomatosis? What's that?
It's a rare condition where symmetrical fat deposits occur throughout the body.
And how did you arrive at this conclusion during lunch with Dr. Johnson?
Amazing. What you can find on the internet. I noticed a common trend among moderators in the hospital Discord server and had a brilliant idea pop in my head before I got banned.
And the prognosis?
The prognosis for benign symmetric lipomatosis is, well, it's not great, but it's manageable. You're one to talk, you incompetent imbecile.
I haven't even said anything yet.
Your team's inability to differentiate between a person with Waardenburg anophthalmia syndrome and benign symmetric lipomatosis is astounding.
That's not my fault. You were the one who was convinced it was W. Whatever, and not BS whatever that you just mentioned.
Well, I didn't make myself look like a fool by admitting my mistake in front of all those people.
You made yourself look even more foolish by trying to shift blame when your team is clearly incompetent.
I'll have you know, I have the highest standards for my diagnostic team. That's why they're so good at making me look like an idiot in front of a room full of people.
That's rich. I actually caught your 3 doctors asking among themselves how long it would take for you to change a light bulb without that cane of yours.
That's called forward thinking. They know there are not a lot of ladders out there compatible with my cane, and they want to change that.
They said there was no way you would ever be motivated to change a light bulb, even if the opportunity presented itself.
You need a fairly high IQ to understand their musings.